Okay, so we're in the treatment plan follow-up bucket, and this is one of the most important buckets for maximizing profitability to a practice, especially a practice that has not been using the Referral Raven system. Switching over to using the Referral Raven system, this is where you're really going to notice an impact on your profitability. And that's because people who have been scheduled for treatment, it's a pretty straightforward process. Someone gets scheduled for a consultation and they go straight into treatment. Well, that's pretty straightforward. They come in, they get treated. Someone that's been scheduled for a consultation, they come in, they get their treatment plan, and they get scheduled for a treatment date. Usually they come in for that treatment date, and treatment proceeds forward as planned. But then there is a big group of people who go to a consultation, they get a treatment plan, and we put a lot of time and effort into getting to this point. Doctors referred them, then we've visited with them, we've put together a plan. We spent a lot of time to get them to this point, and now they decide that they're not ready to commit to either a treatment scheduled date or starting treatment that particular day. So at that point, we have to put them into a treatment plan callback system. So various different offices we've found have various different ways of handling this, and a lot of them are less than perfect and leave a lot of room for slippage for these valuable patients to just kind of slip through the cracks and not get called back and not follow up with. So Referral Raven, it just shines in this department, in the treatment plan follow-up department. So they go into the treatment plan. Usually a treatment coordinator will work this part of the program. A lot of times there will be somebody else who's working the scheduling and getting the people in. Once we have the treatment plan, there will be a treatment coordinator who handles all of their own cases in the treatment follow-up bucket, and those can all be separated out per treatment coordinator. So they land here. Let's say we had a treatment plan callback. Patient comes in, says, "Hey, I'm not ready to do this for another 2 months." So we put the date in treatment plan callback, stick them in the treatment plan callback bucket for 2 months. Say needs to talk to wife, family, finances, whatever the reason. Put a little note in there. 2 months later, they show up here in the treatment plan follow-up action bucket. So the treatment coordinator sees that and makes a phone call and does their very best to get a treatment scheduled date. That's the goal in this bucket, is to get a treatment scheduled date. If that's not possible, maybe they need another week or two to decide, put them back into the treatment plan callback. Another week or two, they'll show back up here. Again, the goal of this bucket, like all action buckets, is for this bucket to be empty at the end of the day. So anybody who shows up here we want to deal with, call them back, schedule, get them going, and get this bucket empty every day. Again, same thing if we're unable to contact them, if we've gone through 2, 3, 4 tries, whatever our number is, we move them into unable to contact. They're notified, sending or referring doctor is notified, and they sit in the unable to contact bucket. If they decline, same thing, we move them to decline, and the referring doctor is notified that that patient has declined. Next, we'll go to what happens after they get through treatment scheduled in our next video.